Primary health care in Saskatchewan needs to evolve to become more accessible, better meet the challenges of rising chronic disease rates, and focus more on illness and injury prevention. Improving access to appropriate primary health care services will help decrease demands on Saskatchewan's emergency departments. Physiotherapy practice includes primary care services such as health promotion, illness and injury prevention, and the diagnosis and treatment of illness and injuries. In other countries and provinces, there have been positive outcomes for patients, providers, and health systems when physiotherapy is included in primary care settings. The Saskatchewan Physiotherapy Association interviewed Dr. Jason Hosain, primary care physician, to discuss the role of physiotherapists on primary healthcare teams.
So my name is Jason Hosain. I'm a family physician in Saskatoon. I work at an academic teaching site at the West Winds Primary Health Care Centre in Saskatoon. This is a little bit different from others in that it's a teaching site, so we have a lot of family medicine residents as well as medical students present in our clinic at all times. It's also a multidisciplinary site in that we have nurse practitioners, pharmacists, and other allied health care professionals in our clinic. One glaring exception to that is that we do not have any physiotherapists in our primary health care center. My view of a physical therapist and their role in a primary health care team is a little bit different. I see physical therapists as playing a role in the making of the diagnosis as well as the treatment side of things. So to expand on that a bit further, the role of physical therapists on a primary health care team is more of a multidisciplinary approach where sometimes we'll see the patient together and bounce ideas off of each other. Look, this fellow's got a sore shoulder. I think it could be this. What do you think? And it's really when you have the two people in the same room with the patient that you actually start to get some of the benefits of having the physical therapist on the team. Any primary healthcare team needed a physical therapist. I would argue that it would need to be a center where medical students and residents are trained so that they get hands-on experience learning to work with these professionals. Most of the people I see, when I ask them if they have a drug plan that covers the cost of physical therapy, the answer is almost always no. So by not having access to a physical therapist as part of the team, it really becomes a question of, do you have access to physical therapists through work, or do you have the funding on your own to pursue physical therapy? So the flip side of that is if we had a physical therapist on the team, we might be able to open up a new treatment option for patients who previously haven't been able to see physical therapists because either they don't have their own financial means to do this, or they don't have drug plans at work that cover this.
Physiotherapists are an important resource to other primary healthcare providers, especially in the prevention and management of chronic disease. Physiotherapists are uniquely qualified to assess and improve an individual's functional independence and physical performance. Physiotherapists deliver effective and efficient care and are well positioned to provide valuable contributions when given the opportunity to be included on primary healthcare teams within Saskatchewan.
about 8 or 9 years ago, where it was a physical therapist who actually diagnosed a gentleman's prostate cancer when I had missed the diagnosis after several visits. So that particular physical therapist actually ended up saving this fellow's life. If any primary healthcare team needed a physical therapist, I would argue that it would need to be a center where medical students and residents are trained so that they get hands-on experience learning to work with these professionals. I want to stress that I don't see the role of the physical therapist on the team as being solely to treat people with musculoskeletal problems. While it would be useful to have them available to see patients with such problems, I think it's important to point out that I really want to be able to have these people involved in cases where perhaps a diagnosis is unclear. Again, helping me make a diagnosis for musculoskeletal problems. An important thing to point out is that family physicians are quite variable in their knowledge and comfort in dealing with musculoskeletal problems. Some of us are quite comfortable, and some of us are really a bit hesitant when it comes to MSK type problems. So having that colleague available on fairly short notice to come and consult with you would be quite useful.